So now we're going to cover Chapter 7, the skeletal system. So some functions of your skeletal system. Provides an internal framework that supports your body. So basically, if you didn't have any bones, your body would just sort of be this like puddle of ooze on the floor. Bones are the thing that gives us structure and shape and form. Without them, we wouldn't have any form or any shape. They really give us the bulk of our body structure. Your skeletal system also protects your internal organs because it creates that kind of hard casing around a lot of them. Like think about your skull for your brain. And it helps to fight diseases by producing white blood cells. That's because your marrow produces your blood cells. So without them, we couldn't really make your white blood cells and you wouldn't be able to fight off diseases. Your bones also make movement possible because they work with your muscles. So when your muscles contract, they actually work by pulling on a bone. So without that like lever to pull on, your muscles would be contracting, but nothing would actually happen. They also store calcium, which is a very vital resource in your body and used for a lot of chemical reactions. And like I said before, with the white blood cells, they also form other types of blood cells, like your red blood cells are also formed in your bone marrow, and that's by a process called hematopoiesis. So there are 4 major types of bones, and they're basically divided up according to the bone shape. So there's a long bone, kind of makes sense. It's just a very long shape. So if you think about your humerus, your upper arm, that's an example of a long bone. A short bone, something that's almost like a little square shape. So if you look at the bones in your wrist on like a picture of the skeletal system, they're almost like little squares. It's a very short bone. A flat bone, that's like your the bones in your skull. They're very flat, kind of like cover a big broad area, but they're not very thick. Irregular bones, examples of those are your vertebrae. They're a little hard to classify because they kind of have bony processes sticking out in a lot of areas. Then there are some people that recognize a sesamoid as being a round bone. So an example of that would be your patella if they wanted to classify that as a sesamoid bone because it's very round in shape. So for the basic structure of long bones, it's kind of what we use a lot of the time. You have your diaphysis, which is the shaft of the bone. It's really a hollow, hard, compact tube. And inside that is your medullary cavity. And that's the hollow space inside, and that contains a yellow marrow, which is really like kind of a fatty tissue. And then on the ends of that diaphysis, you have your epiphysis. The epiphysis is made up of a spongy bone, which contains red bone marrow. That's where those blood cells are being made. And spongy bone just means that it's very porous. They're like kind of looks like a very, really looks like a sponge, but it looks like a very porous sponge with great big holes in it. And then you have your articular cartilage. That's a thin layer of cartilage that covers the ends of your epiphysis, and it provides some sort of a cushion where 2 bones are meeting so that they don't grind bone on bone, which can cause a lot of pain and damage to the other bone. It just acts like a cushion and lubricating surface. Now, covering this whole bone is your periosteum, which is a very strong and fibrous membrane that covers everything except for where there are joint surfaces, and that's because there's articular cartilage there. Another thing is that you have your endosteum, and that's a thin membrane that lines your medullary cavity. So the periosteum is on the outside, the endosteum is on the inside. And that's just a picture of a bone there. You can see where this is your diaphysis right here in the middle. The epiphysis is on the end with these little pads of articular cartilage. Right here is your epiphyseal line. It's also called your growth plate. And your diaphysis actually grows from this point. And that's how you can tell if someone is done growing or not. If they're not, this part here won't actually be calcified over. It'll still be cartilage because cartilage will grow. You can see here is your medullary cavity with the yellow marrow. And then this is your periosteum that covers the whole thing. So a flat bone. Flat bone structure is a little bit different. It's a very thin layer of compact bone. Compact bone isn't as spongy. It's much more dense, surrounding like a spongy bone on the inside. And there are all these open spaces in your spongy bone that are surrounded by bony trabecula. There we go. So you can see that this is the compact bone on the outside, little spongy bone in the middle. And a big part of why it's spongy in the middle is so that you can have that trabecula flowing through here. You're going to get some blood flow through your bones to nourish them so that they can grow. It also makes them a lot lighter. If all of this was compact bone, your bones would weigh significantly more than they already do. So your bones are a type of connective tissue. And there are two different types that are associated with bones. That's the actual bone tissue and the cartilage. So for the bone types, like we were talking about, we have this spongy texture. And there's a lot of texture to it because there are these needle-like threads called the trabecula that are surrounded by all of these open spaces. And this is what's found in the epiphysis of the bones, or in the in between those compact layers on a flat bone. And this is also the space that contains red bone marrow. So here you can see, this is a nice little close-up in here. So you can see where this is compact bone, and then these little things here are your trabecula. You can see where this is letting a lot of little blood vessels all flow through. And that's to circulate the area. So your other bone type besides spongy is compact. Compact bone is a structural unit that has a very calcified matrix. If you remember from the picture before, it was ranged in these like multiple ring layers. And there are bone cells, and they're called osteocytes, that are found inside these spaces, and they're connected by these tiny tubes called caniculi. And the whole thing is covered by a periosteum. So what do I expect you to know? I really just expect you to know that the compact bone is very dense and that it's covered by the periosteum. I don't expect you to know all the names like trabeculi and caniculi and osteocytes. I just want you to know that there's the spongy bone, which is much more open and porous. There's the compact bone, which is really sturdy and dense, and that the whole thing on the outside is covered by the periosteum. So the structural unit is called the osteon, and that's composed of a couple of different things. Like we said, that there are the circular layers of that compact matrix, and then in between them there are spaces, and that's allowing for blood vessels to flow up through. So your bones do get some circulation. Like I said, I'm not expecting you to know all these terms. It's just posted here in case it helps you to understand it a little bit more. But the only thing I really want you to know is that you do have some circulation and blood vessels flowing through your bones. And that's just because if we didn't have any blood vessels there, we wouldn't be able to bring your bones nutrients. We wouldn't be able to bring them calcium or to take calcium away. You wouldn't be able to get the blood flow there to make more red blood cells or take them back out to other parts of your body. And if you damage the tissue, then you wouldn't be able to regenerate it. So there is blood flow in your bones. So in spongy bone, it's like we said, is found in the epiphysis of the bones. It appears much more porous if you look at it with the naked eye. The spaces, like we said before, contain a red bone marrow, and that's where your red blood cells are made. And the texture is just very needle and thread-like. And then on the ends, if you remember that there was that articular cartilage, cartilage is really almost just like a flexible gel substance, but your cartilage does not contain blood vessels. And that's why if you start to get arthritis and you have damaged your cartilage because of it, it's not going to get better. You're not going to regrow cartilage. You're just always going to have an issue with that joint. So the lack of blood flow is actually really important in stages of healing. If it's a part of your body that doesn't get blood flow, it will not heal well. So bone formation and growth. New bone-forming cells are called osteoblasts, and bone reabsorbing cells are called osteoclasts. So I know a little hard to remember blasts and clasts. So the ability of a bone to ossify means like to to build more, to grow, to change shape. And their ability to heal after injury or respond to stress is all because these osteoblasts and osteoclasts are continually working to kind of resculpt your bones. So here, if you look in the picture, you can see there's a little damaged area. So what your osteoclasts are going in, they're actually kind of eating away a little bit at the damaged area and surface to prepare for these osteoblasts to come in and to lay down some new bone. So they're actually laying down some new bone. And then you see the osteocytes, the bone cells are in there. So they've actually just regenerated a new part of this bone here. So bone. Bone is formed really by two different processes. Most bones are developed by a process called endochondral ossification. And some flat bones, though, are actually formed in connective tissue membranes by another process. I don't really expect you to know a whole lot of that. Ossification is actually just the calcification, so it's kind of like it starts out like from your growth plates being a form of cartilage. We're kind of slowly just going to add layers of calcium and bone matrix to that. So that's what I was just saying, is that they're developed from those cartilage models. If you remember when I was pointing out where the growth plate is on a long bone. So they just kind of continue to grow and develop and ossify, so they just form kind of more and more calcified bones from those little cartilage plates and keep making your bone grow. And that's why when you start out, your bone's kind of short and kids are little, and then as they get older, their bones kind of seem to grow with them. So your epiphyseal plate, like I said before, is the cartilage between the epiphysis and the diaphysis, and it's going to remain cartilage until you hit skeletal maturity. Once you hit that skeletal maturity, your epiphyseal plate itself is actually going to calcify or ossify over. It's going to turn to bone instead of cartilage, and that's when growing will cease. So early bone development, before you're actually born, pretty much your bone is just made up of cartilage and fibrous tissue. And then over time, the cartilage is gradually replaced by this calcified bone matrix. And that's because your osteoblasts are constantly going in and making new bone, and your osteoclasts are going in and they're reabsorbing the old bone or the damaged spots or weakened spots. So here you can see the picture where this is just cartilage. You can see now there's some blood supply here, and so now we're starting to calcify this cartilage. Now you see there's a little bit of bone forming, and that's still in the process of being calcified. Here we have even more bone forming. This red stuff is just tissue that's being calcified. You get a little piece up here. Keeps going on and getting more. Here you can still see that this is still cartilage until finally we hit skeletal maturity and this is calcified over. That was where your epiphyseal line or your growth plate was. And then here you can see in kids, where a kid that was just born, a young child, how much of their skeletal system still contains a lot of cartilage. And that's why kids are really flexible, because they're not bone on bone with some ligaments. They have a whole lot of cartilage there to give them a lot more flexibility. So, now that we've talked a little bit about just basics of bones and skulls, let's talk about some divisions of your skeleton. So do you remember when we were talking about how we have an axial part of our body and an appendicular part of our body back in chapter 1? That carries forward now to the skeletal system. So you still have an axial part of your skeleton, and that contains about 80 bones, and that's, like we said before, just like when we were covering kind of the basic anatomy. It's your skull, your spine, or your vertebral column, and your thorax. So that's like your rib cage. And then you have your appendicular skeleton. It contains even more bones, contains 126 bones. That's because you have a whole lot of little bones in your hands and feet. And it contains your upper extremities and your lower extremities. And that does include your shoulder and your pelvis and all of that. Those are the ones that sometimes people get confused on. So, your skeleton is composed of the following divisions of their subdivisions. So your spinal vertebral column is part of your axial skeleton, and that gets divided up even more. And that's because there are 4 normal curves in your back. If you look at somebody who's standing up, they kind of have some natural curves or sway in their back. And those are just normal. They're how the vertebrae set one on top of the other. But there can actually be some altered curves in there too. You can have lordosis, which is a super sway back. So that's your lumbar spine, which is lower back area. If it's like super arched in, that's called lordosis. Kyphosis is when it's your upper back, your shoulder area. So kind of as you're sitting there in your chair, hunched super, super forward, that's what their back is just shaped like. It's why it also looks like a hunchback. And then finally there's scoliosis. Scoliosis is when it's like a side-to-side twist. So it's not just a front to back, it's an extra lateral twist. But normally your vertebral column is divided into a few different categories. Just basically using your bones to divide it. So you have your cervical vertebrae that's up by your neck, your thoracic vertebrae, those are kind of where your rib cage is. Your lumbar ones, it's more lower back, and then your sacrum and your coccyx come in right about where your pelvis starts. So this is just explaining a little bit more about your thorax beyond just your vertebrae. So your thorax is composed of 12 sets of ribs. In your sternum, which is also known as your breastbone, and your thoracic vertebrae, because that's what it goes back and attaches to. And now your ribs have a couple different subcategories even in themselves. You have true ribs. Your true ribs are pairs 1 through 7. You can count them down. And they're called true ribs because they're attached to both the vertebrae in the back and your sternum in the front. Your false ribs are named because they're attached in the back and then they come forward and they're actually attached to the ribs above them with cartilage. So they don't really attach to the breastbone themselves. And then your floating ribs are 11 and 12, and they're named that because they're attached to your vertebrae in the back, but they're actually not attached to the front really at all. It's just a little bit of cartilage stabilizing them, but it's not quite like those upper ribs are. So, the skeleton, like we said, is composed of even more subdivisions. So besides just our axial skeleton, which we just covered, we have our appendicular skeleton. So that has the bones in your shoulder or your pectoral girdle, and that's like your clavicle and your shoulder blades, and the bones of your upper extremities, arm, forearm, wrist, your hands, and then the bones in your lower extremities, and that includes your pelvis, or your pelvic girdle, your thigh, leg, ankle, foot. Those are all part of your appendicular skeleton. So your upper extremities, it's just a list of what's included in there. We kind of touched on that. So your scapula and your clavicle, your humerus is your upper arm, your radius and ulna is in your lower arm. You have a bunch of carpal bones, which make up your wrist, and then your metacarpal, which is your hand, and then your phalanges, which are your fingers. Now, do I expect you to know every skeleton or all the skeleton and all the bones in the human body? No. I expect you to know some of the big ones. So, like skull, I don't expect you to know all the divisions of the vertebrae. Probably cervical vertebrae would be the only one that you'll really see come up frequently. I don't expect you to know like where the lines are, like 1 through 7 is this. Just a little more of like where the general location of them would be. And then I kind of expect you to know like humerus, radius, ulna, your femur, and your lower extremities. Just some of the like big major bones. But I'm not going to ask you to name how many phalanges there are and like organize the carpal bones in the wrist or something. So lower extremities, since I was just talking about that, it's going to start with your pelvis or your pelvic girdle, and those are actually formed by 2 separate bones that are attached to each other with the sacrum right behind it, and they're attached to each other with cartilage, which gives it just a little bit of flex. And that allows them to articulate in shape and flex a little bit based on what we're doing. So I say flex and based on what we're doing because think about like childbirth. Obviously your hips have to have some ability to move to accommodate for childbirth. The other thing that's in your hip is that there's actually this cup-shaped socket. It's going to articulate with your femur head. And anytime you ever see the word articulate, what it means is that it's actually where two bones meet and a joint is formed there. So below your pelvis, you actually have your thigh bone, which is your femur. And then there's your patella, which is your kneecap, and that articulates with both your femur and your tibia. So your tibia is your shin bone, and your fibula is beside that. It's kind of a supporting bone for your lower leg, just like how your arm has the two bones in it. So does your leg. And then you have your feet. I'm not going to expect you to know all of these, just that there are a whole lot of little bones in them. And then here we go with a picture. It's a pretty similar picture to what we saw earlier, where the axial skeleton is marked in blue. And then your appendicular skeleton is here in that like bone-like color. So you can see where your floating ribs here aren't really attached to anything. See how those are floating? And then these ones are your false ribs because they're not really attached straight, like directly to this. They just have this like little line of cartilage here that's helping to hold them up. So what are some differences between the skeleton of a man and a woman? Kind of touched on this with the pelvis, but there's a lot more to it than that. So first, their size. The male skeleton is generally a lot larger in shape. If you just look at any normal size male and female, you can kind of see where that is. Their skeletal system is just built to be bigger and bulkier and to support more muscle structure. And then there's the shape of the pelvis. The pelvis of a male is shaped a little bit more deeper and narrow. It's a little more upright. Where a woman's pelvis is broader and more shallow, and that's to accommodate being pregnant. And the size of the pelvic inlet. So the pelvic inlet is if you were looking up, like straight up at the pelvis. It's the hole at the bottom of the pelvis, and in a female one, it's wider, and that's because it has to be large enough to squeeze a baby's head through. And then the pelvic angle, the angle between the pubic bones on a woman is normally wider. Basically for the same thing, it's because it has to allow room for a baby to come through. So here you can see the shape. So in a guy, normally this hole is very narrow and their pelvis is deeper and more upright. And then in a woman, the angle here is wider, their pelvis is wider, and this hole is a lot bigger. And that's because they need to fit a baby through here. That's how we were at least evolved to happen. So joints. Like I mentioned before, joints are called articulations. So every bone except your hyoid bone, and that's one in your mouth that anchors your tongue, connects to another bone. Somewhere it connects to another bone. And joints are classified differently based on the type of movement that they have. So they can have a synarthrosis, which means that there's no movement at all. There's fibrous connective tissue that connects it to another one and it does not allow it to move. So that would be like in between your skull bones, because you do have different skull bones, and the joints between them are actually fused together, which just allows them not to move. Movement. So the next so these are just some pictures of those. So this is in your skull bone here. You can see where these are fused by some very fibrous tissue, so that's not going to allow a whole lot of flex there. Where here in the pelvis, there's a little bit of tissue here, or a little bit of cartilage here that's going to give it a little bit of flex and a little bit of mobility. It's not totally fixed like in the skull, but it's not really a full-fledged mobile joint. So for some other types, you you can have a diarthrosis, which is when there's free movement. So most joints really belong in this class. And that's really the joints are very freely mobile. There's a joint capsule, which is where there are some ligaments that hold the two adjoining bones together, and they permit movement of the bones because ligaments are fairly, they're fibrous, but they're fairly flexible and mobile. Remember how we talked about before on long bones, there was the articular cartilage on the ends. And that's going to absorb some shock and be some of a cushion and help lubricate those ends so that the bones move pretty well together. There's also a synovial membrane, and that's going to line the whole joint capsule, and it secretes a synovial fluid, which is a lubrication fluid for your joints. And then the joint cavity. The cavity is just the end between the ends of the two bones in that joint capsule. So that's what your joint cavity is. So here is a picture. So you can see where this is your articular cartilage right here. That's going to cushion. And then this here on the ends is your synovial membrane, and that's going to secrete the lubricating fluid. You can see here, this is making up your joint capsule. That's creating this nice little pocket to keep it all contained. So some examples of freely mobile joints. We have the ball and socket, hinge, pivot, saddle, gliding. A lot of these are fairly common, good for you to know. Probably the two ones that you will see most often are the ball and socket. I think I talk about them. Yes, here we go. The ball and socket and the hinge joint are some of the more common ones. So we'll just go kind of down our list here. So for hinge joint, that would be like your elbow. And that's because it works like it's on a hinge. Just kind of goes up and down. Doesn't really have a side to side or all around motion. It goes up and down. A pivot joint is one that's going to go on an axis. So that would be like how your, let's see, this example is the head of the radius rotating against the ulna. Just trying to see, or I was going to say actually your head can go back and forth. Your cervical vertebrae rotate pretty well, and that's how they do it. They're going to rotate back and forth. They'll pivot. A saddle joint, an example of that is your thumb, and that's because it's almost like a hinge joint, but it allows for a little bit of side-to-side motion as well. And then you have a condyloid joint, and that it's a little bit more of a gliding kind of motion. It's almost like a ball in a socket, and it kind of can rotate back and forth and side to side, but not quite with the same motion as a full ball and socket, which is like your shoulder joint or your hip joint. And finally, you have gliding joints, which is more that side-to-side motion. So really, what do I expect you to know from this? I want you to know ball and socket, and that's because those are some pretty common ones. And then probably your hinge joint, because that's your next most common one. And that's because your knees and elbows are those, and those are pretty common places to get injured. But ball and socket joints definitely get talked about a lot. So now how about some skeletal disorders, since we've covered a lot of anatomy and some basic stuff. So you can have tumors of both your bones and of your cartilage. So an osteosarcoma, that would be one of your bone tissue, and that's a very serious and malignant type of bone cancer. Some pretty frequent sites for that are in your femur. So distal femur, so distal means further away, right? Or your proximal tibia, or proximal humerus. So proximal means closer to, so closer to your trunk. Or then you can have a cancer of your cartilage. So that would be the second most common type of cancer in your skeletal tissue. Some frequent sites for that are your medullary cavity in areas like your humerus or your femur and your rib cage or in your pelvic bones. So those are some pretty serious types of cancer to have. And here are some pictures where you can see where that is not normal growth of bone tissue in here, right? So those are some pictures of what the cancer would look like. So moving on from cancers, you can also have some metabolic bone disorders. Most common one of these is osteoporosis. Osteoporosis is characterized by the loss of calcified bone matrix. That means you're losing that calcified bone tissue. And it's a reduction in the number of trabeculae in the bony, in your spongy bone. So if you remember, the trabeculae were kind of the like needle and thread-like parts of it. So they were making the shape of those, like the trabeculae was the bone part, not the open hole part. So there now is not as many of those bone parts, and there's a whole lot more open part in the bones. So this really, really weakens them. It makes them fracture a lot easier, and that's why people with osteoporosis tend to, like if they fall, they're going to fracture their wrists or their hips by falling. They're much more likely to get compression fractures in their vertebrae just from like literally their own weight on their vertebrae. So that can be pretty serious and difficult to manage. And for treatment of that, a lot of the time it's drug therapy. There are some different medications, prescription medications that people take that they're going to help how their body uses calcium. We're also going to supplement them with calcium and vitamin D. And another thing that's really encouraged is exercise. That's the one that a lot of people are like, exercise? The reason for that is because if you do weight-bearing exercise, and that's things where like you're up and walking around, you're having to support your own weight, what it does is you're going to create these tiny little microfractures. And this is a lifelong thing. You will create tiny little microfractures in your bones. And what will happen is your osteoblasts and your osteoclasts are going to come in. Your osteoclasts are going to kind of eat away the area around that fracture. And then your osteoblasts are going to lay down even more new bone. So they're going to like seal over that area of those little microfractures and actually make your bones bigger and stronger. So they encourage people who are starting to develop osteoporosis to actually go into a weight-bearing exercise program. You can even do that before you have osteoporosis because it'll give you a much better base. It'll give you really good, strong bones to start with, so that then even if you do get osteoporosis later on, it won't affect you as much because you already have good, strong bones to start with. So here's a picture. You can see this is someone normal looking spongy bone. So see how this is pretty thick trabeculae, and there's a lot of it around. There are just some little holes in it. And see how thin and brittle this trabeculae is. It's very, very thin and worn down, and the holes are much, much bigger. So this is someone with osteoporosis. So for more metabolic bone diseases, there's rickets and osteomalacia. Both of these diseases are characterized by a loss of bone minerals. It's related to vitamins. So rickets is when you've lost, rickets is the loss of bone minerals that occurs in infants and very young children before they've hit skeletal maturity. And that's when their bones lose rigidity, and it causes some very gross skeletal changes like the bowing of legs. And it's because you don't have enough vitamin D in your diet. And when it says the gross skeletal changes like the bowing of legs, it's because they're less rigid. So now they're more flexible. So literally by carrying your own weight on these flexible bones of your legs, they're going to bow out because you can't support your own weight because your bones aren't rigid enough anymore. And we treat this just by making sure that they get enough vitamin D. So this is a kid who is standing flat-footed, and look at how his legs are bowed. So that's from rickets. So a lot of the time you see this in kids that maybe don't spend a lot of time outside because vitamin D is one of the vitamins that's synthesized by the sun, or they don't eat a lot of foods that are supplemented with vitamin D. So even though they might be getting enough calcium, if you don't get enough vitamin D, you're not really going to be able to use that calcium to the most. So osteomalacia is when the mineral content that vitamin D is lost from bones in adults who already have mature bones. And where in kids, it just makes their bones more flexible, and adults, it makes them kind of more brittle, and they're more susceptible to being fractured. So once again, that's something that we're going to treat with vitamin D. So another type is Paget's disease. And that's when there's like a faulty remodeling process. So basically it just makes these really deformed bones. Because they're deformed, they're not growing normally, they fracture really easily. And that's normally caused either by a genetic factor or it's triggered by a viral infection in the bone. So here you can see where this bone is actually just kind of grown not quite correctly. That's Paget's disease. So osteogenesis imperfecta. This is also called brittle bone disease for more layman's terms. And this is because the bones are literally brittle. They're literally brittle because they lack a lot of that strong organic matrix of bone tissue. And the treatment for this is normally some splinting to reduce the risk of fracturing. So it's kind of just like stabilizing those bones because they're super brittle. Or you can actually do drugs that are going to decrease some of that cell activity. So we're going to try to decrease your osteoclasts from going around and eating up some of that extra bone tissue to preserve as much of it as we can. So you can see here, so that's somebody, look at how their bone is actually grown. Super deformed because it's just brittle and can't support itself. And then here, these are somebody that have actually had pins in their legs. If you see, this is inserted when they were a kid and they're actually extender pins. So see right there is where it's almost like telescoped. So as they've grown, these pins have actually grown with them to help stabilize those brittle bones. So those are some metabolic problems. You can also get bone infections. Bone infections are called osteomyelitis. And that's just the general term for a bacterial infection of the bone. Normally it's a staph infection, and they can be pretty serious. The treatment might actually involve surgery because they might have to actually go into the bone to be able to drain out any pus that's forming there. Oftentimes it involves an IV antibiotic treatment for a very prolonged period. And that's because while your bones do have circulation, it's not a ton of great circulation. So it actually is going to take a really long time to heal and to recover from that infection. And that is a picture of someone who had a pretty nasty osteomyelitis, and look at how it ate away at that bone surface. So for fractures are another very common thing. Probably almost everybody fractured a bone as a child. There are a couple of different kinds. There are open or compound fractures, and that's when the fracture actually pierces through the skin, or it can be a closed or simple fracture. Those are ones where everything stays contained. So most fractures that we see are simple ones. They're very contained. So the open fractures are the ones that actually pierce through and puncture the skin. And fractures come in a couple of different types. It can be complete, incomplete, linear, transverse, or oblique. So a complete fracture is like A here, where it's gone completely through. This is also an open or compound fracture because it's actually broken the skin. B here is a simple fracture because it has not broken the skin, but it's also a complete fracture because it went completely across. Here you see that one's a complete fracture because it completely fractured the bone. This one is an incomplete because it did not completely fracture the bone. It only fractured part of it here, but this side is still all intact. So these ones are actually directions. So linear means that it actually just traveled down the length of the bone. Transverse means that it went sideways across the bone, and oblique means that it kind of went up at an angle or down at an angle or some sort of spiral. It means that it's not like a clean cut across or straight up and down. So besides metabolic disorders and fractures, we can also have joint disorders. These are also very common. We see them quite a bit. There are some non-inflammatory joint disorders, and these don't involve any inflammation of the synovial membrane. And they tend to be very local. They don't go systemically. It's just the little areas. So this would be like osteoarthritis or degenerative joint disease. So this is a non-inflammatory part. This is just the normal wear and tear arthritis. This is like when you get the morning stiffness and the joint pain. Maybe you get some kind of like big kind of knobby knuckle looking things. And this is the most common reason why people end up needing like knee replacements or hip replacements. It's just the one localized area where their joints have just kind of degenerated and there's a lot of arthritis there. So arthritis is just that calcified tissue rubbing against each other. You don't have a good cartilage cushion anymore. So that's someone who just has arthritis in their hands. You can kind of see where they're a little bit big, but their whole hands aren't swollen. They don't look red or painful or anything. Their knuckles are just a little bit big. For other non-inflammatory joint diseases, you can actually have a traumatic injury. So that would be like a dislocation or a subluxation. And that would be when the articular surfaces of two joints have actually knocked themselves out of place. So kind of like pulling your shoulder out of that ball and socket joint. So now the ball and socket are not lining up anymore. You can also have a sprain. A sprain is an injury to the ligaments around a joint. If you remember from when we were talking about what makes a joint, the ligaments are the fibrous part that kind of hold the joint together. They hold the two bones together. And that's like a whiplash injury. A strain is when it involves kind of like the whole musco tendon unit. So that's when there's muscle and tendons involved as well and where they attach, not just the ligament that supports the joint. And that would be a strain versus a sprain. So I normally remember this because it has a T in it and there are tendons involved, not just ligaments. So a strain involves tendons because there's a T. So now we've talked about the non-inflammatory types of diseases. There are also a lot of inflammatory types of diseases, like arthritis. Osteoarthritis is a non-inflammatory type, but a lot of them are inflammatory related. So arthritis in general is normally talking to some inflammatory joint disease. This can be caused by infection or injury or genetic factors or some sort of autoimmunity. But it causes an inflammation of the synovial membrane. So remember that that's the membrane in the kind of joint cavity, and often has some systemic signs of inflammation going on. So some examples of this would be like rheumatoid arthritis. So rheumatoid arthritis is an autoimmune disease. Autoimmune means that it's the body attacking itself kind of without need to. And it causes a chronic inflammation of that synovial membrane. And it can even start involving other tissues such as blood vessels, or it can cause some inflammation in your eyes, or your heart, or your lungs. You're normally in a lot of pain. Another type is gouty arthritis, and that's when there is synovial inflammation caused by gout. And gout is actually, it's an accumulation of urate crystals that collect and form in joints. A lot of the time people with gout notice it first in their feet, like they think their big toes hurt, the joint in their toes start hurting, but it can actually spread and hurt their fingers and everything as well. And then you can also have infectious arthritis. And that's when you have arthritis resulting from an infectious pathogen. A very common one for this is actually Lyme arthritis. Lyme disease is very well known for getting into joints and infecting them and deteriorating the integrity of the joint and causing arthritis. So this is a picture of someone with rheumatoid arthritis. Rheumatoid arthritis is normally known by that kind of odd outward flare appearance of the fingers. Then this is gouty arthritis. So you can see where there's all of this very big kind of painful swelling around her joints. And that's because that's the accumulation of urate crystals. And that would be the end of our skeletal system slideshow.